Hello, welcome to this NMC OSCE update video. My name's Hannah. I'm UK registered nurse, a university lecturer, and I've been an NMC OSCE programme lead in the past. And I provide one-to-one tutoring for international nurses and also UK student nurses. So I thought I'd do a really brief update on some of the recent changes, so March changes to the OSCE stations for adult, but also for all fields in relation to the professional values and evidence-based practice. So wanted just to clarify and clear up any confusion around some recent changes in the nursing station timings and on the NMC marking criteria. So there's been some station updates, but mainly removals of some stations from the APIE, from the professional values and the evidence-based practice sections of the OSCE. So firstly, for APIEs, this is for adult nurses only, there has been official removal of the asthma APIE scenario in station and the anxiety and depression scenarios. So you are down just to your 10 APIE scenarios for the adult OSCE, so Alzheimer's disease, chronic heart failure, the community assessment, ectopic pregnancy, end of life, fall and fracture, hernia, homelessness, pneumonia, and subdural hematoma. So everything else remains the same, but those two stations have been officially removed. So you'll be pleased to hear that adult nurses to have a little bit less to learn. What else has been removed? So they've taken out 4 professional value stations. So they have removed the concealment of bed status, confidentiality scenario, false representation, and professional confrontation. So this applies to all fields. So because you all have the same professional values, evidence-based practice and potential scenarios. So that is taking you down to a few less scenarios, so 11 scenarios here instead of 15. So for bullying, a drug error, falsifying observations, falsifying timesheets, hospital food, impaired performance, laboratory results, possible abuse, racism, social media, and witness abuse are all still in the OSCE for all fields. And the other 2 stations which have been removed is in the evidence-based practice, so cranberry juice for UTIs, and this is most probably because this is quite an outdated topic now, and that research has kind of been discredited as well. And they have also removed the autism evidence-based practice scenario as well. So 2 less, but all the others remain. So we've still got ankle sprain, bedside handover, cervical screening, dementia and music, diabetes, female MI symptoms, fever in children, pressure ulcer prevention, restraint, saline versus tap water, smoking cessation, and honey dressings for venous leg ulcers. So they're the kind of the new updates. So some stations removed for those written stations and some APIE stations removed for the adult nurses, which you'll be pleased to know about. The marking criteria is updated to reflect this, and you'll also notice that they have now officially removed the nasal pharyngeal suction from the marking criteria. This has not been tested since September, but had remained in the marking criteria for research students, but that has now also been removed. They have also updated the subcutaneous injection to reflect the insulin pen. This was done a few months ago, but if you hadn't realised, this is now in the marking criteria to reflect the best practice for an insulin pen. So I hope that's helpful for you. And please like, subscribe and share my videos. Love to hear all your success stories, so please keep coming those in so I can share those with all our OSCE passers. And keep watching. I'm hoping to put up some more APIE tutorial videos soon as well, so things such as hernia and fall and fracture, so some of those stations that we haven't covered yet.